So in the surgical specialties, you combine seeing patients in the office or in the clinic with doing surgery in the operating rooms, as you can imagine. So it's a mix of patient care in the office setting and then a mix of surgical interventions in the operating room. So I can walk you through the last couple of days I'll tell you how my week has been. I was on call for my training institution, several of the hospitals. So on Monday, I went to a surgery center and I did 6 spinal surgeries that were designed to relieve pain and restore neurological function. One of them involved an operation through the front of the neck to remove a bulging disc that was pinching a nerve and causing severe neck and arm pain and weakness and numbness. And the other surgeries that day were in the lower back to also relieve the pain emanating from a pinched nerve in the lower back from wear and tear or bulging disc. On Monday night, I got a call from an emergency room about a young lady who was 37 years old, and she had just given birth to her first child through a C-section. And her husband brought her in the emergency room because she developed severe headaches. To the point where they were not controlled with regular medication. So the emergency room got a scan of this young lady's brain, and she had a pretty large brain hemorrhage. She then deteriorated to the point where she lost consciousness and she required ventilatory support for breathing. And so we had to put her on the ventilator, and then we transferred her by helicopter to my home institution. And on arrival, she became comatose. She was unresponsive, and she had what's called a dilated pupil, which is a very concerning sign that could suggest that there's tremendous brain swelling, compressing the brain stem, which is a vital structure of the brain responsible for consciousness and awareness, and her ability to breathe and maintain normal blood pressure. And so we took her to surgery at 6 o'clock in the morning for an emergency brain operation to evacuate a brain hematoma. Once we completed that, I had to go back to the surgery center to do another spinal surgery. And then I saw a number of patients in my office with various conditions of the brain and spine in a clinical setting. The following day, we had to do another urgent operation in a lady in her 40s who was dizzy and developed some blurriness in her vision. And she was found to have a very large pituitary tumor. The pituitary gland is a gland that sits at the base of the brain and that secretes hormones that are very important for the body metabolism and for maintaining the normal functioning of various organs. And sometimes patients can develop tumors from the pituitary gland, and they can grow near or onto the optic nerves, which are the very important nerves that provide us with our vision. And she had developed a significant visual field defect from a large pituitary gland. And so that day, we ended up taking her to surgery for an endoscopic tumor resection through the nose with a small camera with the assistance of my colleague from the ear, nose, and throat department. And what's remarkable is the day after she woke up and her visual fields were back to normal. And she's incredibly thankful that we were able to restore her vision. A follow-up to the lady with the brain hemorrhage, which was very concerning, is what's remarkable is she went from a comatose state after surgery to being able to open her eyes and now follow commands and regain her level of awareness. So that's a snapshot of the last 3 days of my practice, right?